Hi, my name is Dr. Janet Chelliah. I'm a GP in Sheffield. South Asian Heritage Month has made me reflect on my own origins. So I was born in Malaysia, but my grandparents came from Sri Lanka and South India, and they emigrated to Malaysia in the early 20th century. So with lots of several South Asian countries being part of the British colony, it was normal then for people to migrate from various South Asian countries to other countries that were under the British colony. And this was to help them find a better life, really, for themselves and for their families. So both my parents were born in Malaysia, and they didn't have very much money when they were growing up. My mother's father worked as a healthcare assistant, and my father's father worked in the post office. Both their mums didn't work, so they came from humble beginnings, and but they made the most of it. And my dad didn't go to university, instead started working early to support his oldest brother through his law degree. And my mother was a teacher. My father worked his way up and did very well in his life. He was the director of a company that looked after several oil palm and rubber estates in Malaysia. And it's through the hard work of my grandparents and my parents I have been educated outside of Malaysia. I've always wanted to work as a doctor in Malaysia and to study medicine in Malaysia, but the places for medical students was limited. And therefore my father felt the best option for me was to pursue my medical degree in a Western university. So I moved to Adelaide for 6 years, where I did my medical degree. It wasn't easy for me to move from an Asian country to a Western country. However, I made friends for life there and had the best experience, as we medical students supported each other through the challenges as a medical student and living in a foreign country. So what brought me to the UK? My sister, who lives in London, encouraged me to come over to do my elective in London. So I did a 6-week elective at St George's Hospital in Tooting, and I was really impressed with the NHS, the work ethics, the diversity, and the way the NHS was run. This was going back in 1992. Impressed me, and I felt like it was an institution that I wanted to belong to. So I applied for jobs and got my first job in Aberdeen. So it was the first place I applied for a job, and I got it, and I accepted it. It was closer than being in Adelaide from London. Little did I know that I was going to meet my husband in Aberdeen, and here I am. I've worked for the NHS now for 28 years, and I've been a GP for 22 years. So I initially trained in obstetrics and gynecology and obtained my membership in 1999. However, I then decided that I wanted to be a GP. I felt it would give me a better work-life balance. And I also liked the fact of being a family doctor and to having having sort of regular patients that I saw, and to get to know my patients and their families. And that's why I chose to be a GP. So I've been a GP in Sheffield since 2003. And I was a partner for 12 years in a practice in the north of Sheffield. And I grew very fond of my patients, and I still miss them. I'm currently a salaried GP in Rotherham. So being an South Asian doctor, there are certain stigmas that I'm aware of. Mental health, disability, and cancer are things that are quite not talked about as much in the community. However, the younger generation are pushing this forward and progressing with it. And I think it's important to have open conversations within the community. when I was growing up, I was always told to respect the older generation, and I think that is a very important teaching that I grew up with. But I think, however, I think it's still important for the different generations to mix and to speak openly about issues. My oldest daughter has got a disability, and that's opened up a whole different world to us as well. And we've made some brilliant friends through the local support groups and dance groups that she belongs to. And following this, I also took the job of the Deputy Director for the Special Olympics Summer Games that was in Sheffield in 2017. And I had a brilliant time getting to know other health professionals that came from all over the country. And I was also the resident doctor at the Athletes Village during the week of the Games. And I was very in awe of the athletes who took part in the Games, and it was lovely to meet them. So what would I have done differently as a young South Asian doctor that came to this country in the early 1990s? I wish I had more confidence to apply for leadership roles, and my advice to young South Asian doctors who are emigrating here to work in the NHS is to not let anything hold you back from applying for such roles, as diversity and the differences in culture that we come from can only enrich an establishment like the NHS. I'm glad I've been given this opportunity to talk about my origins in South Asian Heritage Month. I think it's important as it's made me think back about my upbringing and how it's influenced the person I've become. And I think South Asian Heritage Month is an important month for all of us, as a large part of the workforce in the NHS and various parts of establishments throughout the UK are made up of staff of South Asian origin.